Hello, Dr. Bradley Shepard here, calling from Simply Chiropractic for another short YouTube live video. I hope that this is going to be fun and enjoyable for you and informative. And today I want to talk a little bit about hormones and low back pain and if there's a correlation and a connection. So, spoiler alert, yes, there is. There is definitely a correlation between hormone balance and low back pain. And I see a lot of low back pain in my clinic. A lot of times it is caused by these hormonal imbalances. So I want to kind of explore that just a little bit. So we've talked a lot about thyroid in some of the previous videos, and the thyroid definitely has an influence on pain in general. And there's something called hypothyroid myopathy, which is basically the fancy way of saying there's something going on with the muscles that's being caused by the thyroid. And so we have that thyroid myopathy, and it's really important that we take into consideration if you've tried other therapies for low back pain, whether it's medications, whether it's physical therapy, or even chiropractic treatment, and you're not getting the results, maybe there's a good chance that there is a thyroid issue that is causing a lot of that achiness and soreness in your low back. Of course, there's other things other than hormones that we can look at, but that's a really nice place to start. A second hormone that is really involved with the low back is estrogen, and estrogen levels, a decline in estrogen levels can actually increase the risk of intervertebral disc degeneration. So if you've ever heard of degenerative disc disease or something like that, anything that causes deterioration of the discs. The discs are between the vertebrae. They provide some shock absorption and they provide space for nerves. So the discs are very important to keep healthy. And so if you're having a decline in estrogen levels, you're going to see an increase in that degeneration. And that's true for both males and females, by the way. Estrogen typically is excuse me, is typically thought of as a female hormone, and it certainly is. In fact, females are going to generate a lot more estrogen than males are typically. However, males also produce estrogen, and so it's important to check the levels of estrogen in males and females, and correlate that with any sort of disc degeneration. So, again, estrogen levels that increase the risk of disc degeneration. And it's fairly simple to increase the estrogen levels with either bioidentical hormones, or, in my opinion, a better way is to check out the nutrition. Make sure you're getting all of the nutrients, minerals, and vitamins that you need to make estrogen in the first place. Otherwise, you're going to be on estrogen replacement for the rest of your life. And for menopausal women, that may be a reality as well. But still, with my nutrition approach, it's beneficial for everybody, because nutrition, I think, is the foundation of health. So if you're not getting the proper nutrition, you're not going to be as healthy and as well. And so that's a very basic foundation for me. Another hormone that we can certainly talk about is testosterone. Yes, lower testosterone levels can increase the incidence and severity, and it can amplify low back pain. Incidentally, it can also increase neck pain and other musculoskeletal conditions too. So estrogen and progesterone and testosterone are all, they all work together in both males and females, more so with the estrogen and progesterone in females and more with the testosterone in males. However, there are some patients that I see that are female that have low testosterone levels, and they also have the chronic low back pain. And so as when we adjust those levels through nutrition and we see the lab results normalize, their low back pain is less severe. And so testosterone can certainly amplify the pain, in addition to all the sexual dysfunctions that it causes, and the fatigue and everything like that. So testosterone is a very important marker that we want to look at when we're doing lab testing when there's any sort of chronic pain involved. And uh, the last hormone that I want to talk about today is not a very well known one. It's called DHEA, and DHEA is a hormone that is produced in the adrenal glands along with cortisol and some of the other stress hormones like adrenaline and things like that. And DHEA is very important because low levels of DHEA can affect the other hormone levels. Okay, so the DHEA actually combines with cholesterol to make testosterone, progesterone, and estrogen. So if you're low in DHEA, you very well may be low in those other levels. And so if you have low testosterone or low estrogen and you aren't checking the DHEA, that's another line further down the line that might be causing those deficiencies. And so it's very important that we test DHEA. And I always test DHEA when I'm testing for on any other hormones because it's such an important hormone to look at, and it influences all of the other hormones. And so low levels of DHEA it can amplify pain, and it can contribute to inflammation. And whenever we have inflammation, of course, we have pain. And so that's a really important hormone marker to look at. So that is something that I always look at. So this is, again, a really quick video. I hope it's been helpful for you. And please comment on this. I do react to the comments. I do respond if you have questions. If you feel like you have chronic pain and that your hormones may be contributing to that, give us a call at our office, 575-915-1550, and let's talk. I'll set aside 10 minutes or so out of my schedule so I can talk with you directly one-on-one, and we can see if this might be something that would be helpful for you. So again, thank you so much for watching. Enjoy the rest of your day, and we'll see you next week.